Contin is a medication used to relieve severe ongoing pain, such as pain due to cancer. It belongs to a class of drugs known as opioid analgesics, and it works in the brain to change how your body feels and responds to pain. The higher strengths of this drug, 100 milligrams or more per tablet, should only be used if you have been regularly taking moderate to large amounts of opioid pain medications. Using these strengths without a tolerance can cause overdose or even death. It's important to note that the extended-release form of morphine should not be used for mild pain or pain that will go away in a few days. It is not meant for occasional, as-needed use. The dosage and timing of taking this medication should be determined by a healthcare professional based on the individual's specific medical condition and response to treatment. Make sure to read the medication guide provided by your pharmacist before using Contin, and ask your doctor or pharmacist if you have any questions. Take this medication on a regular schedule as directed by your doctor, not as needed for sudden, breakthrough, pain. You can take this drug with or without food as directed by your doctor, usually every 8 or 12 hours. Some brands should only be taken every 12 hours. If you experience nausea, it may help to take this drug with food. Swallow the tablets whole, do not break, crush, chew, or dissolve the tablet. The dosage is based on your medical condition and response to treatment. Do not increase your dose or use this drug more often or for longer than prescribed. Before starting this medication, ask your doctor or pharmacist if you should stop or change how you use your other opioid medications. Suddenly stopping this medication may cause withdrawal, especially if you have used it for a long time or in high doses. When this medication is used for a long time, it may not work as well, so talk with your doctor if this happens. Be aware that this medication may sometimes cause addiction, so take it exactly as prescribed. Finally, tell your doctor if your pain does not get better or if it gets worse. Some common side effects of Contin include nausea, vomiting, constipation, sweating, lightheadedness, dizziness, or drowsiness. These side effects may decrease over time. To prevent constipation, it's important to eat dietary fiber, drink enough water, and exercise. You may also need to take a laxative, so ask your pharmacist for the right type for you. Be careful when standing up to prevent dizziness or lightheadedness. You may notice an empty tablet shell in your stool, but this is harmless as your body has already absorbed the medication. Remember that the benefits of this medication outweigh the potential side effects. However, be sure to contact your doctor if you experience any serious side effects such as interrupted breathing during sleep, mental/mood changes, severe stomach pain, difficulty urinating, or signs of adrenal gland issues. Seek medical help immediately if you experience fainting, seizures, slow/shallow breathing, severe drowsiness, or signs of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist. When taking Contin, it's important to be aware of the potential risks and side effects. This medication has the potential for abuse and addiction, which can lead to overdose and even death. It may also cause severe breathing problems, especially when starting the medication or after a dose increase. It's crucial to take the smallest effective dose for the shortest possible time to minimize these risks. It's important to discuss with your doctor or pharmacist whether you should have naloxone available to treat opioid overdose. It's also important to educate your family or household members about the signs of an opioid overdose and how to treat it. Avoid taking Contin with alcohol or other drugs that can cause drowsiness or breathing problems, as this can lead to very serious side effects, including death. Make sure you understand how to take the medication and which other drugs to avoid while taking it. It's important to store Contin in a safe place to prevent theft, misuse, or abuse. If someone accidentally swallows this drug, seek medical help immediately. For women of childbearing age, it's important to discuss the risks and benefits with a doctor before using this medication. If you are pregnant or planning to become pregnant, it's important to inform your doctor. Using Contin during pregnancy may slightly increase the risk of birth defects if used during the first 2 months, and using it for a long time or in high doses near the expected delivery date may harm the unborn baby. It's important to take the smallest effective dose for the shortest possible time to lessen the risk. Additionally, babies born to mothers who use this drug for a long time may develop severe withdrawal symptoms, so it's important to seek medical attention if you notice any symptoms in your newborn baby. Before taking Ms. Contin, make sure to inform your doctor or pharmacist if you have any allergies, especially to opioid pain medications like codeine. It's also important to discuss your medical history, including any brain disorders, breathing problems, kidney or liver disease, mental/mood disorders, and any history of substance use disorder. This medication may cause dizziness or drowsiness, so it's important to avoid alcohol or marijuana while taking it. Be cautious when driving or using machinery, and talk to your doctor if you're using marijuana. If you're planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you're using. For older adults, be aware that you may be more sensitive to the side effects of this drug, such as confusion, dizziness, drowsiness, and slow/shallow breathing. If you're pregnant, only use this medication if it's absolutely necessary, as it may harm an unborn baby. Be sure to discuss the risks and benefits with your doctor. This drug can pass into breast milk and may have negative effects on a nursing infant, so consult your doctor before breastfeeding. If your baby experiences unusual sleepiness, difficulty feeding, or trouble breathing, contact your doctor right away. It's important to be aware of any potential drug interactions that may change how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Ms. Contin include certain pain medications, naltrexone, and samidorphan. Taking this medication with other products that may cause drowsiness or breathing problems could increase the risk of serious side effects. Be sure to tell your doctor or pharmacist if you are taking other products such as opioid pain relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Check the labels on all your medicines and ask your pharmacist about using those products safely. Additionally, Ms. Contin may interfere with certain lab tests, so make sure lab personnel and all your doctors know you use this drug. Always follow your doctor's instructions and take Ms. Contin as directed. If someone has taken too much Ms. Contin and is having serious symptoms like passing out or difficulty breathing, it's important to give them naloxone if available, and then call 911. If the person is awake and not showing any symptoms, it's important to call a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. For Canada residents, you can call a provincial poison control center. Symptoms of an overdose may include slow or shallow breathing, a slow heartbeat, or slipping into a coma. Remember, it's important to seek medical help immediately if you suspect an overdose. When taking Ms. Contin, it's important to follow your doctor's instructions carefully and take the medication at the same time every day. This will help ensure that you receive the maximum benefit from the medication. Please do not share Ms. Contin with others, as this is against the law. Remember that Ms. Contin has been prescribed specifically for your current condition. Do not use it for any other condition unless advised to do so by your doctor. If your doctor recommends a different medication for another condition, it may be necessary to switch to that medication. If you forget to take a dose of Ms. Contin, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take your next dose at the usual time. Don't take extra medicine to make up for the missed dose. When storing Ms. Contin, make sure to keep it at room temperature and away from light and moisture. It's important to keep all medications out of reach of children and pets. Do not flush Ms. Contin down the toilet or pour it into a drain unless specifically instructed. When the medication is expired or no longer needed, be sure to discard it properly. For more details on how to safely dispose of Ms. Contin, you can read the medication guide or consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.